For those of you who don't know me or my cancer story, I'd like to share with you the following so you can see how breast cancer care has supported someone like me through my diagnosis and treatment, and how important this charity is, not just to me but to everyone that's affected by breast cancer, whether they're going through it themselves, know someone that's going through it, or fear that they might have breast cancer. I was just 32 and had been recently made redundant at 12 weeks pregnant. I'd had my beautiful baby girl who we named Rosie, but when she was 8 months old I found a lump in my right breast. Just didn't think that something was right really. I had this pain in my ribs, so I went to the doctors to get it checked out. She wasn't overly worried, but I was soon referred to the Breast Institute. The day of the investigations I wasn't very worried about it, but once I saw the look on the man's face who performed the ultrasound, fear struck me. I was scared. And for that week afterwards, waiting for the results, I didn't know whether I had cancer or not. So this is where breast cancer care came in as a lifeline to someone like me. I used their services from looking on their website and to also find out information about breast cancer, treatments, what I might face if this actually was cancer. So after a week, I eventually went back to the clinic to be told, Janine, you have cancer. This is something that in your 30s, 40s or whatever age you don't expect to hear. This point in my life will never be forgotten. My life went in a direction that I had no influence over. This was the point when I had to now not just be a mum, wife, friend, sister, daughter, but also a cancer patient too. This was new to me, just like the first time you have a baby, when you have to learn on the job. So I had to learn right from the beginning how to be a cancer patient, how to tackle treatment head on, and how to carry on living. It was time to juggle a sickly baby, believe me, she was sickly, a demanding 3-year-old, and also what was for tea, when would I rest, all these things going round in my mind. How would I cope? I had to cut my long hair, which was part of me in preparation for what was to come with the chemotherapy and the side effects that it would bring. This was just the start of the next 6 years of adjustments, and now I'd like to call it adjustments as I feel I've adjusted fairly well on what's been thrown my way. My mastectomy was booked in, right boob chopped off. Now this is where the page name comes from. So I still have my left boob. And when people say to you, put your best foot forward, I was trying to think of a name and I thought, actually, I still have my left breast, so I'm going to put my left breast forward. So left boob forward was born. I then commenced the recovery period, which was extremely hard with 2 young children. But I decided not to have reconstructive surgery as my priority was caring for my young family. So the new flat-sided me tried to look on the bright side and got back to my new normal, as I'd like to call it. As soon as this happened, wham, chemo was injected into my veins, whether I wanted it or not really. What choice did I have with 2 young children? I couldn't be responsible for leaving them without a mummy. I had to try and kill this aggressive cancer. I was diagnosed with stage 3 HER2 and estrogen positive cancer, and it was in most of my nodes that they removed. My hair started to fall out after 2 weeks of having my first IV infusion. This was the tipping point for me, as my hair really did make me feel like me. I just couldn't brave shaving it off like a lot of people do. This was far too final. I was in denial until one day I was alone and started pulling my hair from my head, which left little strands at the bottom. Tears were flowing freely as I watched my hair being flushed down the toilet. But looking on the bright side, out came Wiggy. So picture a 10-month-old and a 3-year-old on what their needs are, coupled with severe constipation and vomiting, not a pretty picture, and a nightmare to get out of the house. Having children's a nightmare enough, but to have chemotherapy on top is really, really testing. I again went on the breast cancer care website to look for advice and to see how other people coped with all of this. I met some wonderful ladies on the forum who, just like me, had a young family and similar problems. This was my lifeline. I can't express how important it is to be put in touch with people of your own age, or even people who are older, just because they know exactly how it is to go through a cancer diagnosis and what that might mean for them. So this was a really positive occurrence the past 6 years, meeting people just like me. And this was because the Breast Cancer Care website has a forum on it where you can post questions and you can meet other people. Absolutely essential. I ordered a book from the Breast Cancer Care website called Mummy's Lump. At that time, so 2010, my eldest daughter Sophia would have been just 3 years old. How do you tell a 3-year-old that their mummy has cancer, is going to lose their hair, is going to be feeling pretty rough, sick? This book was absolutely brilliant. I sat down with her, showed her the pictures and slightly adapted the book really to how my situation was. And this gave us some time to actually absorb what was actually happening and to hopefully at the end of it all have a nice holiday when I was starting to feel better and supposedly cured of cancer. So fast forward 18 weeks, the end of my initial chemotherapy, I thought I was nearly there, I can do this. My eldest started school in September and I had 5 solid weeks of radiotherapy, which was really tough, as the tiredness is something that I have never experienced, apart from obviously when you have a new baby and you're sleep deprived. It's very much like that. So the following year, after having a year of IV Herceptin, trying to keep the cancer from coming back, I was called for my annual mammogram. Several weeks later, I got a letter saying no evidence of cancer or clear. This was such a huge relief, as the year before I'd gone through all of this and I needed to know that it was for something, that I was going to survive this. However, problems started happening to me. I started to feel lumps in my remaining left breast and were convinced myself that I had cancer. But rather than telling everybody, oh, I think the cancer's come back, I don't like to make a fuss, I booked myself into the Breast Institute and went for some more investigations. Thank goodness nothing showed up. The ultrasound was clear and I was told to go away and enjoy my life and basically get on with it, which is what I tried to do. I tried to think, right, okay, I've been made redundant, I need to start now getting a new career. So I went on the forums, tried to find out how other people went about finding work, and tried to be positive. So I retrained to be a lecturer in travel and tourism, as I already had my degree and several years in the industry, working in hotels for an airline, etc. And I thought, right, I can do this. I've always wanted to be a teacher. So in the October 2011, I got my first lecturing job, which was absolutely fantastic. The old Janine was slowly starting to emerge. Fortunately, 5 weeks later, I had to go back to the Breast Institute. My husband said, you know, I can feel a lump too. And I said, yes, I think it is still there. So I went for another ultrasound, which was told we can't see anything. You've just got dense breast tissue. Unfortunately, after a freehand core biopsy and pure optimism from the surgeon who did this, I was called back to be told, Janine, it's returned. Hearing those devastating words when you have tried to fight, you've tried to focus forwards, be positive, this was really hard. So again, you know, trying to talk to people and trying to be positive again was really hard. But I'd made some fantastic friends who I still meet up with regularly as well from the Breast Cancer Care forums. And somehow you pull yourself through it. So after hearing this shocking news, which, like I say, was probably one of the worst things that I will hear, that it'd come back, I was booked in for a mastectomy. Unfortunately, that was cancelled because the cancer then started to come through the skin. I was very lucky that I was given the opportunity to go on a drugs trial with Kadcyla, which is now licensed on the Cancer Drugs Fund and remains on the Cancer Drugs Fund thanks to people campaigning to keep this fantastic drug, which gave me 2 years of cancer-free years really, with minimal side effects. I could continue to work, I could continue to be a mum, a wife, daughter, and try and live as normal as possible. And to cope with this, again, I turned to the Ask a Nurse helpline that Breast Cancer Care offer free of charge to someone like me. Breast Cancer Care are there for people when they need them the most. So I managed to get 2 years out of the drugs trial, fantastic 2 years. Then to be told that I had to go back onto different drugs, and unfortunately these drugs didn't work. So in May 2014, after the cancer had progressed to my lung, my skin again, I was put on the drugs I'm on currently, capecitabine and lapatinib, and I got cancer drug funding. So I'm immensely grateful, and I'm still enjoying a full response with these drugs. It's not easy, and I experience horrific side effects, and you know, reading up about these drugs and treatment on the website really helps. Finding out what to expect, it's like being submerged into a black hole, not knowing what's next. So to try and help with these anxieties and not knowing what's facing you, it's a huge relief to have a charity like Breast Cancer Care there to virtually hold my hand. I attended the Young Women's Breast Cancer Primary weekend back in 2010, where I met women in a similar situation, was given information on treatments moving forwards after breast cancer treatment. And when I was diagnosed with secondaries in September 2014, I was lucky enough to gain a place on the secondary event in London, which again I made some fantastic friends and could put a face to a name of many people that I'd met on close Facebook groups and also on the Breast Cancer Care Forum. Fantastic lifeline. I learnt about drugs trials, I learnt about coping with the uncertainty of having a cancer diagnosis, and it's people like you who can help people like me and people that are going through breast cancer, to be able to give them this support through this charity. So the purpose of me doing this video is to really highlight some of the issues that young women face, and also, you know, men and women who are diagnosed with breast cancer, because yes, men can be diagnosed with breast cancer, although less common, it still is out there, and you need to be aware to check your breasts regularly. So the purpose of me doing this really is to raise awareness of breast cancer, and also of Breast Cancer Care's support that they actually give to people going through and suffering from cancer, breast cancer. I have been lucky enough to be chosen for the Breast Cancer Care fashion show in London at the Park Plaza Westminster Bridge on November the 2nd this year, and I'm delighted to have accepted the place along with 31 other models. So I'll be taking to the catwalk on that day to hopefully raise more funds. So if you're wondering how can you help, it's simple. If you can attend the fashion show, all profits go towards breast cancer care services. If you can't attend the fashion show, I will be having a Just Giving page, and also events leading up to the fashion show in November. So hopefully with your support, Breast Cancer Care can carry on giving people like me the support that they need in the hours of darkness, when things aren't easy and we're struggling to cope. It's an absolute lifeline for people like myself, and I'd just like to say thank you. So if you can support Breast Cancer Care in any way that you can, that would be great. I have a Twitter feed, Left Boob Forward, and also a Facebook page, Left Boob Forward. If you can share please, so we can reach as many people as possible and highlight the fantastic work that Breast Cancer Care do. Thank you.